Without a doubt, period cramps are one of the most important topics of women's health. If you've ever wondered why they happen and what's going on inside your body during menstruation, you're not alone. The science behind it is actually fascinating, so let's take a closer look. To understand period cramps, we first need to understand the key players involved. This is the female reproductive system. Here, we have the uterus, which plays the central role. Connected to it are the fallopian tubes, which transport the egg from the ovaries. Below the uterus is the cervix, which leads to the vaginal canal. In front, we have the bladder, and behind, the rectum. Now that we're oriented, let's dive into the menstrual cycle and how it leads to cramps. Let's first review the relationship between the menstrual cycle and endometrial growth. The uterus has one major job: to create the perfect environment for an embryo to develop. To do that, it builds a thick inner lining called the endometrium. Each month, as part of the menstrual cycle, the ovaries release hormones, primarily estrogen and progesterone, that stimulate the endometrium to grow and become rich in blood vessels. This prepares the uterus for a possible pregnancy. If fertilization happens, the embryo attaches to this thickened lining and starts forming the placenta. But if pregnancy doesn't occur, the uterus decides it's time to reset, and that's when period cramps come into play. So what exactly causes those painful cramps? It all starts with ischemia, which is a temporary lack of blood flow. As hormone levels drop, because there has not been a pregnancy in that month, the blood vessels supplying the endometrium start to constrict. Remember that the endometrium was thick with a network of blood vessels in preparation of a pregnancy during that cycle, right? As the blood vessels supplying the endometrium start to constrict, this cuts off oxygen and nutrients, causing the uterine tissue to break down. This process alone can trigger pain signals. Then, the uterus itself begins to contract. Think of it like a muscle squeezing tight to shed the old lining. These contractions help push the endometrium out through the cervix and down the vaginal canal. The stronger the contractions, the more discomfort you feel. But there's one more key player behind period cramps: prostaglandins. These are hormone-like chemicals that tell the uterus to contract. The higher the levels of prostaglandins, the stronger and more painful the cramps. Some people naturally produce more prostaglandins than others, which explains why cramps can vary from mild discomfort to severe pain that interferes with daily activities. This is important because it shows that every woman's experience is unique and every woman experiences cramping differently. I have heard stories whereby women have been placed in the same pot being told by their care providers or people around them that period cramps are normal and every woman experiences the same. Thing is, we cannot normalize pain, we should treat each woman's experience individually. In my African society, I know that women with painful period cramps have been told that these would vanish when they get pregnant and have a birth. They are usually advised to get pregnant as remedy for the pain. What do you think about this? Have you experienced this too? Please share your opinion in the comments section. Let's proceed with our discussion of period cramps. How long do the cramps last during a menstrual cycle? On average, menstrual cramps last between 3 to 5 days, aligning with the shedding of the uterine lining. However, the duration and intensity can differ from person to person. The big question here is, when should you be concerned? While period cramps are normal, having seen the physiology behind them, excessive pain that disrupts daily life could be a sign of underlying conditions such as endometriosis or uterine fibroids. If your cramps are unbearable, it's always a good idea to talk to a healthcare provider. How do you manage and reduce cramps? Fortunately, there are ways to reduce period cramps. Here are some effective strategies. Apply heat. This is because a heating pad or warm bath can help relax the uterine muscles. Stay active. Gentle exercise releases endorphins, which are natural pain relievers. Hydrate and eat well. Anti-inflammatory foods like ginger, garlic, leafy greens, and omega-3s may help. Drink lots of water and healthy fresh juices. This area of nutrition can be enormous and overwhelming, but the rule of thumb is that you should keep it natural and fresh. Pain relief. NSAIDs, like ibuprofen, reduce prostaglandin levels, easing cramps. This is really good remedy for cramps. Ensure to start medicating as soon as you have a feeling the pain is setting in and not wait until the pain is unbearable. Do you know of other remedies? Please share in order to help someone on this community. So, there you have it. Period cramps happen because the uterus is resetting itself, using muscle contractions and prostaglandins to shed the uterine lining. While they're a natural part of the menstrual cycle, they don't have to take over your life. If you found this video helpful, make sure to like, share, and subscribe for more insights into women's health. Thanks for watching. Please remember to seek medical advice for professional advice.